Good afternoon, good evening, everybody. Welcome to our Q&A webinar. My name is Rachel, and I'm the CEO of Virtual Fields. Virtual Fields is an exceptional eye exam experience with visual fields, color vision, and pupillometry exams inside a comfortable, patient-friendly headset. And today's guest is Dr. Justin Schweitzer. Dr. Schweitzer, would you mind briefly introducing yourself?
You bet. Thanks for having me. Excited to have a conversation today with you. So I'm an optometrist at Vance Thompson Vision in Sioux Falls, South Dakota. My day-to-day activities really involve managing glaucoma, anterior segment disease, cornea, cataract. I work alongside a couple other optometrists as well as a glaucoma trained, anterior segment trained surgeon. I'm the optometric extern director at our center, and love being a clinician.
That's amazing. And today's topic is contribution to the profession, and we'll jump right into our questions. So you have held various leadership roles in all different types of organizations. How do you balance your clinical practice with your commitments to professional societies and editorial positions?
Yeah, it's a very good question. Balance is a hard thing with anything that we do, but I think it starts with number one, having a supportive team at the clinic. That's the first thing, and then having a supportive team at home. Those two things have always been first and foremost in making sure that I can achieve some of the goals that I have for myself and hopefully helping to our profession as well. And I have a great support partner optometrist in Mitch Eibach. I have a great surgeon partner in John Birdall, and they would be the first to tell me if things were getting a bit out of balance. I would listen to them and I would realign and shift my goals. And then at home, my wife, she'd be the first to tell me as well that, hey, you're not balancing things well, and I would realign. And has that happened? It has. It's happened, and you have to make those decisions. If you care enough about, number one, your clinic, and you care enough about your family, you're gonna realign those goals and make sure that you're doing what's best for those two things.
That's amazing. It sounds like you really leverage your relationships to create something that works for everybody. Thank you for sharing that. Uh, could you discuss your role as the program chair for Eyes on Glaucoma and for Modern Optometry Live? What are some key topics or themes you focused on in these roles? What is this role all about?
Yeah, it's really been an honor to have the opportunity to be able to chair both those particular meetings. And they're unique. Each of them are a little unique in their own way. Let's start with Eyes on Glaucoma. Eyes on Glaucoma really started when a colleague of mine and myself hosted a glaucoma educational event in his practice, Dr. Damon Durker. It was a very small gathering. We wanted to take kind of a problem-based approach to managing glaucoma patients. And, we had probably 20 to 30 optometrists that joined us for that event. And from there, it kind of grew. And then I had the opportunity to work with the Eyes On team to start with Eyes on Glaucoma. And we've tried to keep that same theme. How do we educate, our colleagues, optometrists, ophthalmologists around glaucoma, but keep it very relevant so that the next day after our education, you're able to take those things and manage patients immediately. And so that's where Eyes on Glaucoma came from. From a modern optometry standpoint or Mod Live, it's unique in its own way. It's different. It's more of an integrated meeting. And so it's a meeting where there's ophthalmologists and optometrists there. I think the other unique thing that we've done with that meeting is that we've made it easy for optometrists that want to connect with industry partners. We've made it intimate enough to be able to do that. So it's not a large meeting, but it's a cozy meeting is the way I would put it. And there's still education, and it's an integrated approach. And so unique in its own way. And I've been lucky enough to be a part of both of those meetings from the beginning and help kind of shape those meetings along with a lot of other, really helpful colleagues that have been there with me.
Awesome. Thank you for describing the different areas and brands of those programs. In addition to everything we've chatted about so far, you are also co-chief medical editor for Modern Optometry. Tell us a little bit about that, and how do you see that publication contributing to the dissemination of knowledge and the advancement of the field?
Yeah, another honor to be a part of, to be honest with you. It's been a fun ride for me. And, it all started with, BMC who asked me to be a part of it. Modern Optometry, was launched, and Modern Optometry is a publication that's focused on the medical side of optometry. How do optometrists contribute and manage things medically? That's what we've always focused on. And I got to launch that with my co-chief medical editor at the time, Leslie Odell, who is just an amazing person, an optometrist. And now, as times have changed, I get to enjoy the ride with Selena McGee and Walter Whitley. They're my co-chief medical editors, and I learn something new from them every single day on this ride of co-chief medical editor in this publication. I think it's a unique publication in that the goal around it was to keep the articles very short and digestible. We didn't want to have 2,000 word
Mhm,
articles that maybe someone wasn't going to read.
mhm.
We wanted it to be 300 to 500 words, and we wanted it to be very medically oriented so that optometrists, again, could digest it, take it to their clinic the next day, and utilize it in patient care. And that's our goal still. That's what our goal has been over the years, and we're continuing to try to do that.
Yep, makes sense. Um, let's change gears a little bit. So an additional role you have is treasurer of the Optometric Glaucoma Society. Particularly as treasurer, you're implementing financial strategies, initiatives. How do you think about the financial well-being of that organization and other organizations you're part of? How is that part of the picture?
Yeah, I think one big strategy as the treasurer and then also our board in general, we have discussions around this is we want to recruit new members and we want to recruit new young members, new optometrists coming out of school, coming out of residency to be a part of this, society. And in order to be a part of the society, it isn't just, hey, you sign up for it. You need to have a passion for glaucoma. You need to be actively managing glaucoma. And we really ask for a publication as well. And so some of the initiatives around that for me are making sure that we're recruiting new members that want to be a part of this particular society. But I think the other thing around it, not just necessarily financially, is it's a group that's really taught me how to lead better.
Oh,
They've
cool.
taught me how to understand how to help to organize and be part of a successful society because it's a very successful society. It
Mhm.
grew from a few small members to, a large group of members at this point in time. And I'll miss names, but I've learned from, Murray Fingered, Mike Chiglazian, Ben Gaddy, Eric Schmidt, Rich Madonna, Danica Morelli. They've all taught me so much with it. And
Mhm.
so a society that we continue to recruit, look for young members, and hopefully will continue to grow.
Awesome. In a previous role, you served as president of the Intrepid Eye Society. Could you share some memorable experiences or achievements from your time in that role and how they have continued to influence your approach to leading in the profession?
Yeah, we don't have time for all the memorable experiences I could share with this group, but I'll share a few. And as I was reflecting on this, it's crazy to me to think that that society now is 9 years old. When we started it in 2015, it was myself and Dr. Michael Cooper, Coop, who many may know. I got on the phone with him, you know, floated the idea to him, and we started to recruit some doctors for this Intrepid Eye Society. And the goal behind it was really just to get some like-minded clinicians together in different areas of our profession. So some people that focused on glaucoma, some people that focused on, diabetes, retina, whatever it may be. And if nothing else, become lifelong friends, but also can we move the profession forward? How do we do that? What I'm probably most proud of is how much better it is now that I'm not the president of it. It's crazy to me to think when I was president, we had 15 to 18 members and it was fun, but we weren't really making an impact yet. Now I look at it and we have 30, 35 members or so that are a part of it. I am no longer president. I'm a member, but no longer that president. And they've started their own meeting. They partnered with Review of Optometry and are going to be doing 2 meetings this year. When you look at Intrepid Eye Society members, a lot of them are on the podium educating. They're in research. They really are doing something to help move the profession forward, which is much different than when it started 9 years ago. So I think that's probably what I'm most proud of is just the group of people and the way that they've worked together and how much of a better clinician they made me because they hold you accountable because you have to be at the top of your game when you're in a room with those people and they're just all amazing individuals.
Yeah, we do have a question from an attendee, so I'm going to jump to that.
Love it.
And the question is, what drives you to contribute to the community as much as you do? Good one.
Yeah, it goes back to that initial question when you have this support group around you that encourages you to do these things. My clinic, for example, the people that I work with within my clinic, whether it's our executive leadership team, John Birdall, the surgeon that I work with, Vance Thompson, all the different types of leaders within our clinic when I first started with them back in 2012 encouraged me to not only be a great clinician, which I do believe I am, but to contribute in other ways to the profession. And so that was very eye-opening to me and drove me to start getting more involved. And then I think having the support at home again, my wife saying, "Oh, if you're excited about these things, then do it." And so I think that drive started. And then as I got mentored by different individuals, different doctors, you get to some national meetings, some state meetings, you notice how much of an impact you can make because they're making that impact and it continues to drive you. And so those are really the reasons why I continue to try to stay as involved as I can with these things.
That's really compelling. So you learned from mentors who are giving back through various organizations, research, attending meetings. Um, Now that you think about maybe the next up and coming generation or students or younger professionals, what advice would you give them if they are looking to make these types of contributions as well?
Yeah, there's opportunities. Now, it doesn't happen right away. It does take time. I think back of my journey, it started off by attending an optometric glaucoma society meeting and then going to a second one. And then you start to meet individuals. And as you're there more and more and you start to establish yourself, leadership opportunities do present themselves. I think I would also encourage anyone that's interested in getting to some of these different areas of leadership or positions is just get your name out there. How do you do that? You do it by writing. That's how I started, with just doing some writing.
Nice.
And these publications, they want you to write. Now, again, I'm a co-chief medical editor. If you want to write, shoot me a message. You can shoot me a message. We're always looking for motivated clinicians that want to write and educate in things that they are experts in. And by doing that, that helps as well. If you're passionate about it, it's a big deal. And then get involved with your state society, get involved with the AOA. There's opportunities just to volunteer.
Mhm.
Submit lectures. If you want to be a lecturer, submit lectures to different types of meetings, and you're going to get turned down at first, for sure. It happens. I got turned down over and over again. That didn't stop me from going to these meetings, meeting people, perfecting your craft, getting better at it. So those would be other advice I would give you. And then, find a few mentors. Find maybe two that can help guide you through that pathway. Someone that's already been there, someone that is, maybe if you're interested in writing, find someone that's already doing that. Or if you're interested in being someone that is on the podium, find someone that's already doing that. Or you want to work with the industry, find someone that's doing that. Craft it the way that you want to around mentors, and that can be very valuable as well. But it'll take time, and it does. It took time for me as well.
Um, awesome. Related question from our attendees. I'm sure the answer is yes, but maybe we could talk through, how have you been a mentor to somebody just starting out?
Yeah, it's a great question. So, in our practice, it's probably more internal for me right now, but I would say I have some in our Intrepid Eye Society that I hope would say that I've been a mentor to them. When I think of our practice, for example, I was the third optometrist that started there back in 2012. We now have just in Sioux Falls 9 or so right now. And I think the other thing is we've started an externship program since I started in 2012. We now have a residency program. And so I feel like I'm mentoring all of them on a daily basis.
Yep.
I also would say that it's probably one of the most fulfilling things that I do and didn't think it would be. I was excited to have an externship program. I was excited to work with residents. I didn't realize how fun it really is until you start working with them in the way that I do. And so, yeah, I think I've had the opportunity through natural growth within our practice and then different leadership roles in Intrepid Eye Society. I hope that, I'm the president currently of the South Dakota Optometric Society and done in about a month, going to be off of that. But I hope that there's some young optometrists that have moved in the state of South Dakota that are interested in getting involved into that as well. And I've actually had a couple reach out already. And so, I'm more open than ever to be able to connect on those types of things.
That's great. And we were chatting casually before we opened the webinar to our attendees, and I kind of casually asked you, of all of these roles, which is your favorite?
Being a clinician, that's still my favorite, seeing patients. I love to be in the clinic. I love being around our team, taking care of patients on a daily basis. I do enjoy the other things. I enjoy them a lot. I enjoy being able to go to an academy meeting and seeing all our colleagues, and going to an optometric glaucoma society meeting and sitting with the board members. But still, none of that really would have happened if I wouldn't have been a clinician. I went to optometry school, got focused on taking care of patients, and so at heart, I still my favorite thing is taking care of people.
That's amazing. How do you think the various roles you have had have made you a better clinician? You've talked a little bit about how they've made you a better leader and what you've learned about leadership. How do you think they've made you a better practitioner?
For sure have. If I think and go through each role that I've played, starting with modern optometry, chief medical editor, I talk to Dr. McGee and Dr. Whitley once a week on things, and we're reviewing articles that are coming through, and I'm by no means an expert in everything. And so we have to lean on each other and lean on other doctors to learn about certain things. And so I learn things right there. So there I'm already increasing my knowledge base on things that I'm not an expert in. If I think of the Intrepid Eye Society, just being a part of that group, the things I've learned about concussions, or the things I've learned about the retina, because I'm mostly anterior segment disease and glaucoma, from my colleagues within that group, just sitting in a room with them, expanding my knowledge base. My own clinic, the doctors I work with on a daily basis in Vance Thompson Vision, you expand that knowledge base, and then go into Mod Live, Eyes on Glaucoma. Yes, I help to co-chair, and I find speakers, and I bring in these experts, but I also get to sit there and I get to listen to them and I get to absorb that knowledge again. And so I think that being able to be around all of it has really helped my growth, not only as a leader, but also as a clinician.
Yep. And then you were also saying earlier the ability to bring it, the next day into the clinic, what you might have learned the day before. That's awesome. Last question for you. So as you think about the future of optometry, what role do you see yourself playing in shaping that future?
That's a big question. When I look at the future of optometry, it's bright. We continue to evolve. When we think of what's happening in the world, on a disease standpoint, we're going to have more diabetes, more cataracts, more glaucoma, more ocular disease in general. So one thing that I always talk about and ask my colleagues to think about, whether you're a resident, you're a student, you're a practicing optometrist, so we have to embrace some of that medical model. That doesn't mean get away from the things that we learn in school, refractive, fitting contacts, all of those things. That stuff is still there, but we have to embrace that medical model because it's needed. Surgeons are gonna have to spend more time in the operating room, and there needs to be that primary care provider that can handle these types of patients, and that's us, the optometrist. For me, what are my goals and roles going forward? I hope I have the opportunity to continue to educate from the podium, and that my colleagues appreciate that. I love continuing to work and plan to continue to work with our externs and our residents to hopefully shape some of the future around that. And I don't plan on stopping that anytime soon. I plan on hopefully being a voice still to our industry partners. It's important to be a voice to them. They want to hear what we have to say. We're the ones utilizing the technology. We're utilizing the new pharmaceutical agents. And so we want to continue to be a voice for them. So I want to continue to do that. And then I want to be a leader in our organization at Vance Thompson Vision. I want to continue to do that because, again, that's one of the most important thing to me from a clinical standpoint, is making sure that we're successful within those four walls.
That's awesome. Thank you so much for your time. Any parting thoughts for our attendees?
I just appreciate the active questions. I wasn't expecting that either, Rachel, when this came
Yes,
up. And
yes. No, we have a very engaged audience. Thank you to a
yeah,
great for attendees for the questions.
I love that, and I appreciate the questions. I think that being a clinician, like many of you are on here, it's a great, fun, engaging thing to do. but there's so many more opportunities within our profession to give back to the profession that's helped us and shaped us. And so I just appreciate the conversation to be able to dive into it a little bit. And it's just my story. There's a ton of other much better stories out there in regards to it, but all of us have the capability to do a lot of these things.
No, thank you for sharing about your background and what you've learned along the way. Very insightful. We appreciate your time. Thank you.
Thanks for having me.